Good evening, everyone. Thank you for joining us. I'm Sarah Pendlebury. I'm Board Affairs Coordinator for RNAO, and I'm just going to give a brief description of the technical aspects and House rules for the webinar, and then I'm going to turn the session over to our chair. Our chair is Rhonda Seidman-Carlson, immediate past president and chair of the Provincial Nominations Committee. On your screen, you'll see a photograph of the chair when she's speaking, or a live recording of our candidates, as well as any material that they have provided. Providing material was an option for the candidates and not mandatory. If you'd like to ask a question of the candidate, please type into the chat box that you'll see at the bottom right-hand corner of your screen. Please state the name of the candidate to whom your question is directed to. We'll ask the question to the candidate that is addressed, and then we'll give an opportunity for the other candidate to respond. Please type and send your questions to us as you think of them. After the candidates have given their introduction, we'll then address the questions. The chair will read the question and the candidate will have 1 minute to respond. The candidates will see a warning when they have 15 seconds left to speak. If they go over this time, I'll ask them to stop. I'll now turn the session over to our chair, Rhonda.
They're getting another 60 centimeters of snow today. So anyway, could you all hear me?
Yes, we can, Rhonda.
Okay, good. So tonight's webinar is for the President-elect position. Candidates running for election are Carmen James Henry and Carol Timmings. And we will begin with each of the candidates being asked to speak in the alphabetical order, as mentioned a few seconds ago. Each candidate will have 10 minutes to speak, and they will be timed. And as Sarah has mentioned, a 15-second reminder will flash on the screen. Also, candidates are reminded that they will only have 1 minute to respond to questions at the end of their presentation. I will rotate the order of respondents to the questions. A reminder to members, just as Sarah said, who are joining us online, you are encouraged to type your questions and send them as we go along. And we will deal with questions after both candidates have spoken. I would now like to ask Carmen James Henry if she could present her position, her platform.
Thank you, Rhonda. Nursing colleagues, thank you for the opportunity to introduce myself to you this evening. I am Carmen James Henry, one of the candidates for the position of President-elect. I am honored to be a candidate and excited about the prospect of serving in this capacity, as I believe I will do an excellent job. In the next 10 minutes, I will give you a synopsis of who I am, my philosophy, and what you can expect from me as the 2015 President-elect. It's still here. Sorry, I'm having some technical difficulties here. Okay. So as I mentioned before, my objectives are, I will just give you, in the 10 minutes, a synopsis of who I am, my philosophy, and expectations of, that you can expect from me as the President-elect. Throughout my career of 40 years, as a registered nurse, my practice has been varied. I have had the opportunity and the privilege of working in most sectors of the healthcare system. However, in terms of my education, I possess, I'm a registered nurse, of course, and I have a Bachelor of Science degree from Marcy University, Master's in Education from Ontario Institute of Studies in Education from the University of Toronto. I have a registered nurse diploma from the UK, certificate in parish nursing education from the University of Toronto, and a certificate in midwifery from Essex in the UK. So my career achievements, I've had the opportunity to work in critical care and chronic care as a staff nurse and nurse educator at both Sunnybrook and Scarborough General Hospital. I've worked in public health for 16 years with Toronto Public Health, where my primary responsibility was health promotion in the healthy lifestyles, sexual health, and nutrition programs. I worked as a school nurse developing and implementing these programs to both students and teachers. In the government, within the government system, I was a consultant with the Ministry of Health and Long-Term Care, first helping to develop the accountability agreement between the Ministry of Health, and secondly, to develop a nursing model for the care of clients with hepatitis C. I had the privilege of working in academia as a professor and nursing educator and clinical instructor at both York University and Ryerson University for 10 years. In administration, as the director of hospital operation at a major tertiary care and teaching hospital for the past 6 years, where my primary responsibility is managing all operational and clinical issues as the key decision maker for hospital function. My RNO involvement has spanned over close to 25 years. My active participation with the RNO for close to 25 years has led me to serving 2 terms on the board of directors as Region 7 representative, a member of the Provincial Educators Interest Group, a member of the Nursing Education Committee, the International Nurses Interest Group, and the Policy and Political Action Representative for the Parish Nurses Interest Group. I also held the position of Chair of the RN Journal Editorial Advisory Committee. I have been privileged and honored to have received the 2014 RNU Leadership Award in Nursing Education Academic, and 2012 I had the privilege of also receiving an award from the University Hospital of the West Indies Graduate Nurses, an award of distinction for professional achievement, exemplary leadership, and excellence in nursing. RNU Nurse Ambassador Certificate, RNU Certificate Appreciation Award, Toronto Public Health Professional Practice Award for Preceptors, and at St. Michael's Hospital, an award for excellence in workplace relations. This wealth of expertise will provide me, as it will help to inform my decision-making as it relates to nursing practice and policy development. I am confident that as President-elect, I can provide the leadership that is required to move our professional associates forward. It is significant that the RNO is poised to celebrate 90 years as a professional association representing registered nurses, nurse practitioners, and student nurses in Ontario. Over these years, the association has developed a strong, credible voice influencing the decisions that affect nurses and the public we serve. At this time, I'd like to commend both past and present board of directors and the membership who have led the association on this journey. I am so excited about programs such as the best practice guidelines developed in Ontario now being used in countries like Spain, Italy, China, nurse practitioner-led clinics, the new grad initiative, and 70% full-time positions for RNs are examples of some of our many achievements. I strongly believe that nurses are the cornerstone of Canada's publicly funded healthcare system, and with over 41,000 members, with expertise in the various sectors of healthcare, RNU is best positioned to advocate for access to quality healthcare for all Ontarians. The decisions that RNU makes in the next few years will have long-lasting impact on nursing and healthcare in Ontario for years to come. My vision is that RNU will be the leading professional association dedicated to influencing and positively impacting the health of Ontarians and continue to be a strong, credible voice for nursing and health, not only in Ontario, but globally as well. As a professional body, we strive for congruence with the mission, values, and goals of the association. These include advancing the role and image of nurses as members of a vital, knowledgeable, caring profession, and significant contributors to health and healthcare. Influence healthy public policies to positively impact the determinants of health and supporting our publicly funded healthcare system. And third, speaking out on emerging issues that impact nurses and the nursing profession, health and healthcare. It is essential that we keep these imperatives at the forefront when we collaborate with our various partners to address issues facing Ontario, such as end-of-life care, RN scope of practice and workplace nursing and workplace environment, medical tourism, Ministry of Health, medical tourism, and the environment, and of course, social determinants of health, and in particular, poverty. As the President-elect, I'm committed to membership, looking at ways to develop strategies to increase membership participation and engagement, supporting frontline workers to provide safe, quality work environment, resources to enhance their practice, supporting the President and Board of Directors by working closely with the Ministry of Health or the Minister of Health, the Premier, and other elected members of government to ensure timely response to issues that are brought forward. And ensure that we continue to be vigilant in holding our politicians accountable and monitor the progress of policy development to address these issues. I am excited to be in the position as a candidate for the President-elect, where I will be able to share your voice of influence as we continue to advance the profession, promote the professional contributions of nurses as knowledgeable professionals, agents of change, and advocates for social justice. My passion for nursing, my leadership experience, and my years of practice in varied sectors of the healthcare system and active participation with the Registered Nurses Association of Ontario makes me an excellent choice for the President-elect position. I am committed to continuing the legacy of strong leadership for the RNAO by working together with the RNAO board, the membership, and our national and international partners to be an effective and visionary leader to continue this awesome journey and make a difference. I'm asking for your support and your vote. Thank you again for the opportunity to speak with you this evening.
Thank you very much, Carmen, and sorry that the slides didn't always align with the speech, but we got everything. On this side, we could see everything, so we're good. We saw everything. Thank you very, very much, Carmen. I appreciate that. I'm going to turn over to Carol Timmings. Carol, you have 10 minutes also to speak.
All right. Thank you, Rhonda. Good evening, nursing colleagues, and thank you for joining in on the webinar this evening. My name is Carol Timmings, and I'm very pleased to be running as a candidate along with my colleague Carmen for the President-elect position for the 2015-16 Board of Directors. I'm presently the Chief Nursing Officer and Director of Chronic Disease and Injury Prevention at Toronto Public Health, and I hold a cross-appointment. We need to bring up my slides. I hold a cross-appointment with the University of Toronto Dalla Lana School of Public Health. In this role, I'm accountable for the overall leadership and direction of nursing quality practice, organizational effectiveness, and nursing health human resource planning across the organization. I'm also responsible for the operational leadership of chronic disease and injury prevention programs and related health policy and performance measurement. There we go. All right. I'm a registered nurse. I hold a Bachelor of Nursing Science from Queen's University and a Master's of Education with a specialty in Administration and Policy, also from Queen's University. I'm a long-standing member of RNAO and have served on the board as Member-at-Large Administration for the past 2 years, and recently had the privilege of also serving as a member on the Provincial Expert Panel on Primary Care Transformation. In 2010, I was honored to receive the Alpha Distinguished Service Award, which is an award that's given in recognition of outstanding leadership and contributions to the public health system in Ontario. Over the past 25 years, my career has spanned both acute care and public health nursing, and I've progressed through positions of staff, management, and senior leadership positions over my career. I would say that I'm probably most recognized for being a collaborative leader who values staff, client, and community engagement. And I would say also a hallmark of my leadership is probably my commitment to the social and environmental determinants of health. In the slide that's in front of you, I would like to speak to what I believe are the sort of 4 underpinnings of my platform and what I believe I could bring to the role of President-elect. One is, in fact, a vision for the role that RNAO can play in strategic health transformation and leadership. I think that as nurses in this province, we have a critical role to play in system transformation from whatever vantage point where we do our work. I also think that our leadership in nursing quality practice and in organizational effectiveness is absolutely critical at this time in healthcare and in our health system overall. It's the expertise that we bring to these roles that I think will make a huge difference in patient and client outcomes. In terms of influence, I have had over my career an opportunity to work directly as the Director of Healthy Public Policy and Health Communications in the area of advancing policy, and this is another aspect that I think we could all agree RNAO, as our organization, has done an incredibly impactful job. I think there's lots more that can be done in healthy public policy, and I think this is the area where together we can really shape the environments where people live their lives and where health outcomes can really be positively impacted. In my career, I've also had a wonderful opportunity to be a mentor for nurses and to, in fact, have had my own career touched by very influential and I would have to say life-changing mentors. I believe in nursing, that's also something that we bring by virtue of our profession, and it is also part of what we bring to system leadership. I've also had extensive involvement in professional and national associations. I've been president of the Ontario Public Health Association and currently sit on the governance committee of the Canadian Community Health Nursing Group nationally. I'm also a member of the Nursing Leadership Network and the Community Health Nursing Interest Group as 2 interest groups of RNAO. So in moving to the next slide, I want to speak briefly to my passion. And in my passion for the profession, I really believe that as nurses, we are the heart of the health system. And I say that because there are many contributors to the health system, but I believe that by tapping into the passion, the knowledge, and the expertise that we have in our profession, we have made and have the potential to continue to make incredible differences to the health outcomes of Ontarians. And I think there was never a time more important than now as we celebrate our 90th anniversary to both look back on the accomplishments of RNAO and look at the contributions that as a very vibrant and vital membership we have made, but to also look ahead at the opportunities for us to make a difference in so many levels, whether that's looking at person-centered care, patient-centered care, looking at issues of health equity, where there's a disproportionate and I would say unjust difference in the opportunities that people in this province have for health. So looking at the difference we can make in the determinants of health, looking at how our role is utilized in the system. You know, we have an incredible skill mix in our membership, but I think it's really critical to make sure that we're optimizing our nursing roles, that we're well situated in the system to optimize our roles. We find ourselves on interprofessional practice teams, and I think we really need to be loud advocates and relentless advocates to ensure that the nursing role, whether that's in the student role, in academia, nurse practitioners, in clinical nurse specialists, that we're situated in the system to make the biggest difference and to have the best impact on patient outcomes. The last thing I want to speak to is engagement, because as nursing is at the heart of the health system, you as members are the heart of this association. And I believe that it is by listening to you, the members, engaging you in new and different ways, and really hearing your voices as you speak to the issues and concerns that impact you in your workplaces. Each and every day, I know you are somewhere in the system, making your contribution, dealing with the challenges that come our way as professionals. And as you do that, I want you to know that if I were to be elected president, I would certainly, or president-elect, I would certainly be there together with the board to hear your issues, to engage you in new and different ways, to look at how we can best support the work environments that you find yourselves in. And lastly, in terms of this slide, I want to talk about my ability to actually inspire and collaborate, and really to kind of build a shared vision together. I believe I've demonstrated that both organizationally and at the system level. I have championed the Best Practice Spotlight Organization Initiative at Toronto Public Health. And I have been able to do that together with other nurses and staff who are incredibly committed to using evidence in our practice to, in fact, ensure that the clients and communities we serve have the best chance at optimal health outcomes. I also most recently had the opportunity to reconceptualize a new approach to nursing recruitment at our organization, and that really resulted in an unprecedented pool of diverse, amazingly qualified nurses that we're bringing into our organization. And so I think it's the ability I bring to tap into the energy and the potential of those around me that I also would like to bring to this role. So as a candidate for President-elect, I just wanted to let you know personally that I'm very committed to working with the board, reaching out across this large province of ours to you, our members. I think it's imperative now more than ever that we use our knowledge, our passion, and our influence to shape the future of our profession and of the entire system. I think we have to continue to use our voice. And I think, as importantly, we need to help others find their voice. There are many people in our system who don't have voice, and I think if we're going to advance healthy public policy, we need to do that. So together, I think we can build on the rich legacy, we can use our collective influence, and we can safeguard this incredible universal system that we have the privilege to be a part of. Thank you for your time, and I would be honored to be your president-elect, and I hope I can count on you for your vote. Thank you.
Thank you very much, Carol. I'm going to open it up to questions. They will get posted up on the screen. I will read them and alternate between the two candidates. I'm waiting. Aha, question.
You see us both here?
Question to both candidates. Patients want patient-centered, integrated healthcare delivery. What are the first 3 things you will do to make this a reality? And Carmen, could you respond to that question, please?
Thank you. I will try to respond to that as best as I can. And I think the 3 things that I would first look at is the environment in which this healthcare is being delivered, the providers that are available to do this, and basically the resources that are available to provide this care. Integrated healthcare for me means being able to tap into all the supports and resources that you need in order for you to move from a state of illness to wellness. And I think it's important that we look at how, for example, care is delivered to clients in Ontario, where we can have most of the resources and whether it's healthcare resources or whether it's human resources delivered in a where the patient becomes the center of the care that is being provided.
Thank you very much, Carmen. I now ask Carol, can you respond to this question, please?
Okay, so I would certainly agree that patients absolutely want to and should be our first consideration in provision of health care. I also think there's a lot to be said in terms of looking at integrated health care that makes sense and responsive to the needs of the patient. First and foremost, I think it's important that we have a vision of a health system. All too often, I think we may find ourselves thinking about our work in terms of sectors. I think while that is our orientation, I think we need to look at how nursing as a profession makes a contribution to the system overall. I think the ECHO model of RNAO has really laid out that map, and I think we need to bring that model to fruition. I think we need to ensure that our voice is situated at those critical tables where we're re-envisioning how primary care will be delivered, and ensure that nurses are able to use their skills and roles to full scope of practice.
Thank you very much, Carol. I'll look for another question. How, as a potential president-elect, would you engage further the interest groups in a meaningful way within the Association of RNAO? So, Carol, I'm going to ask you to respond first to this.
Okay. Well, I think the interest groups absolutely are a big part of the lifeblood of RNAO as an organization, and interest groups do incredibly important work in very substantive areas of nursing and healthcare. What I would like to see the board do is find new ways of really engaging and tapping into the interest groups. Look at using opportunities perhaps for interest groups to be able to bring key aspects of their work forward when we get together at the Assembly. Look at opportunities perhaps for interest groups to showcase their work. I think we need to use technology to do that. I think that would be possible to convene some sort of knowledge exchange in terms of the interest groups and look at the way they're doing. And I would love to take the work of interest groups and really inform our strategic plan with that work, because I think they have their finger on the pulse of things.
Thank you very much. Carmen, I'd like to turn this question over to you, please.
Thank you, and I agree with Carol in terms of the interest groups. To me, the interest groups are the vital representative of the community or the membership, and I think it's so important where they are strategically placed and what they bring to the board in terms of members' concerns, members, some of the things that they are doing in the community, and what are important to them as members of the association. So interest groups are so vital because they represent a certain section of the population or the membership, and I think it's important that they are strategically placed to bring that information to the board and how the association as collective, how we're going to use that information to further advance the profession of nursing.
Thank you very much, Carmen. Turn to another question, please. So we're asking our attendees if you have any more questions of our two candidates, if you can type them in, and we will be glad to respond to them. I'll wait a few minutes. I never know how fast typists people can type on their keyboards. Well, seeing no more questions, I want to thank our two candidates, Carmen James Henry and Carol.
Rhonda.
Yes?
Sorry, we just got a question.
Oh, excellent.
We're sending it your way.
Okay. Okay, there you go. To both candidates, Ontario has a culturally diverse population. How do you promote cultural competence in the profession? And I'll ask Carmen if she could speak to that first, please.
Thank you very much, and I think that's an excellent question, considering our diverse population, not only in the clients that we serve, but in the profession of nursing, where we have nurses who are vital to the profession and are caring for clients from different cultural backgrounds. It's important that we are culturally sensitive to these situations, so it behooves us as nurses to be educated as to where the cultural groups are from, what are some of the issues pertinent to them in healthcare, how do we provide care for them, knowing some of their the differences in terms of what they need as clients. So cultural competence for me is a must for our profession of nurses, so that we are able to provide the care that our clients need, whether they're from Asia or Italy or wherever they're from, that we're able to provide the care that is necessary for them.
Thank you very much, Carmen. Carol, can you respond to this, please?
Absolutely. So I certainly would agree with Carmen. I think cultural competency is an imperative in our profession. We have a tremendously diverse province, I think particularly in some of the larger urban centers. And I think as nurses, it's our ability to listen, understand, and communicate as we really start to understand the norms and values that various cultural groups bring. I think it's part of our competency in really valuing and recognizing what patient-centered care would look like for diverse clients. I think it's respecting their cultural practices and really tapping into the wealth of experience. I think we have a very culturally rich workforce often, and I think it really is engaging the patient and the clients to be really full partners in the care.
Thank you very much, Carol. I'm going to see now if there's any more questions. You see people are getting into the swing of things.
Oh, good.
How do you think you could further involve and engage nursing students in Ontario in RNAO? And I'll ask Carol this time to respond first to that question.
All right. Thank you, Rhonda. Well, nursing students, I often say, are the present and the future. I think nursing students have an incredibly valuable role to play, and I would envision engaging them more in both the interest groups, but also tapping into the fact that they are really, I would say, given their proximity as active learners in the education system at the moment, I think they are in a vital role and position to be able to help us see what the kind of emerging issues are and really tap into that energy and that growing knowledge and include them more in many of the operations, of the association. So I think I would look for mentorship opportunities, engagement opportunities, and really speak to the nursing students to see how they see themselves being more involved as well. But I think they're our future. We need them, and we will involve them even more.
Thank you very much. Carmen, would you like to respond to this, please?
Sure, thank you, and I totally agree with Carol as well. And having been in the universities where student nurses are being educated, I think that's a good place to start. And incidentally, when I was working in the universities, I would hold a number of promote a number of events promoting the Registered Nurse Association of Ontario. And from then, they would get a sense of their professional organization and really encourage them to start thinking about becoming members. I was able to get $10 discount for students so that they would start at an early age to become members, associate members of the organization. And I think I've encouraged them where they've come in and actually have done some clinical placement at the Home Office and was able to get a better sense. So I think it's important, seeing that they are the future of the healthcare system, to engage them from an early age into RNAO, and so give them an opportunity to discuss with us what are some of the issues, how they see things changing, what are some of the things they think they can do in order to move the organization forward as well.
Thank you very much, Carmen. Looking to see, here's a long one, okay. RNAO's promotion of the ECHO model is of grave concern to CCAC care coordinators, a number of whom are not nurses, and to the hundreds of CCAC support staff who stand to lose their jobs if the ECHO model is implemented. Will you, as President-elect, commit to spending time on the front lines with CCAC care coordinators to better understand their role in the healthcare system before pushing forward with the ECHO model? So, Carmen, can I ask you to respond to this question, please?
Thank you. And very long and interesting question. I think I see the ECHO model as a really strategic and also essential models for which we can learn or bring the healthcare system forward where there's comprehensive health care. And I think it's important, if there are concerns expressed by caregivers and support staff, that RNAO would be available to help them to understand what the model is about, how they are involved in the model, and to hear from them what are their concerns about it and help to educate them, because I see this as RNAO promoting this ECHO model. I see it as integral to healthcare systems at this point, considering patients are being, or clients are being sent into the community and are being encouraged to, where you have people wanting to stay at home or age at home. I think this is a vital and important model for us to adopt. So, of course, trying to get them to understand this and to help them to see this as a model that should be addressed or to be activated.
Thank you very much, Carmen. Carol, can you respond to this question, please?
Absolutely. So certainly I do see the ECHO model as an important blueprint for system transformation. I think there are many aspects of this model that really look at situating nurses in the overall system where we can provide care and system navigation and coordination in the best possible way. In terms of the concerns articulated in this question, I absolutely believe that it is important that we fully understand the implications of any model change, absolutely. And I think ECHO does a great job of articulating that. If in listening to members' voices and building a deeper understanding of that, it means further engagement with CCAC care coordinators, I'm committed to engaging further. I think that engagement could build a deeper understanding. So in terms of listening to that, absolutely. But I do know that as President-elect, I'm very committed to the ECHO model.
Thank you very much. I'll see if there's okay. What strategies do you hope to implement to ensure sound educational processes for students, for nursing students in Ontario? So I'm going to ask Carol to answer that first, please.
Okay, so absolutely ensuring that the education and the curriculum that nursing students are exposed to and engaged in, we want to make sure that that is sound, evidence-based, and very relevant for the nursing future, for their work they're going to do as they move from academia to practice. I think there are great opportunities for us to influence curriculum. As a couple of examples, I have worked with COSN and with CUPN to really ensure, to do curriculum reviews, to advocate. I think advocacy is a powerful tool that RNAO has to advocate for curriculum change. Most recently, looking at opportunities to advocate on the NCLEX exam to make sure that what nurses are learning is really what they are going to be tested on. So I think there's lots of opportunities for us to engage with our academic partners and talk about the the curriculum.
Thank you very much, Carol. Carmen, could you respond to this question, please?
Yes, thank you very much for that. I do agree with Carol as well, and it's nice that we're agreeing on all these issues.
That's right.
And as an educator of nurses and working in the universities, I do agree that we would, as RNAO, we would need to work with the professional body or the academic bodies that are developing the curriculum, and quite frequently ourselves be familiar with the curriculum. See how nurses being educated from this curriculum, how they will ultimately forward their career and practice when actually being in the workplace setting or in the practice setting. And I think it's important that as experienced nurses as well, we're able to mentor these nurses, because a number of times once they're leave the university, some people think that they are ready to practice, and I think it's important that we provide the environment to further continue the learning that has been happening so that they can develop into mature registered nurses.
Thank you very much, Carmen. Okay, to both candidates, do you have suggestions for integrating the work of interest groups to both regions and member-at-large portfolios? So, Carmen, I'm going to ask you if you could respond first to that question.
Okay, thank you. Suggestions for integrating the work of interest groups to both regions and members-at-large portfolios. So I'm taking it that the members-at-large portfolio is education and administration, those. So the work that the interest groups are doing, I think it's important that that is communicated to the members at large, who are obviously, for example, practice. When I think of what the work that interest groups are doing and the nurses that are implicated are working in these regions and bring those concerns to the board and to the members at large, I think it's important that that is communicated and looked at and worked with. And nurses and the members at large are being very involved in going out as well in their practice setting to understand what are some of the issues and concerns that they're facing and how the work can be integrated so that all the membership benefits from that.
Thank you very much, Carmen. Carol, can you respond to this, please?
Yeah, so when I think of integration, you know, I often think of processes that we can use to actually bring work together. And when I look at the way our large association is organized with chapters and regions and interest groups and member at large, I always think it's good to step back and sort of look at where are we now and where do we need to go in terms of looking at opportunities for these various groups to interface, interact, perhaps even reimagine at some point a different way of organizing the way that our very large membership is arranged across the province. You know, we've been this way for quite a while, and I think it may be time to rethink how we organize interest groups. They're often the same people organizing around different issues and interests. So I think that's something that I'd love to engage the membership in.
Thank you very much. Excuse me, that was just me. I was burping. I'm sorry. Thank you very much, Carol. Okay. How can we develop further the integration of advanced nursing practice into RNAO future plans? So I'm going to ask Carol if she could respond to this first, please.
Thank you, Rhonda. So I'm glad you've asked this question because we were just chatting about this the other day at work in terms of the various, whether or not we're looking at advanced practice, advanced nursing practice, if that's called, or like clinical nurse practitioners. There are many sort of specialized areas of nursing practice that I do believe need some consideration in terms of that depth of knowledge and expertise that comes as part of that role. Certainly, we're all nurses. I think that's the common foundation. But I would really like to examine this further in terms of the unique attributes of these roles, how we may tap into that, and really look at where, in terms of our strategic directions moving forward. I talked about optimizing nursing roles. I think this is one that really warrants further consideration and discussion. I'd love to talk with advanced practice nurses and really look at and hear their thoughts about fitting in a more prominent way in RNAO.
Thank you very much, Carol. Carmen, can you respond to this question, please?
Thank you. And as Carol said, I think this is a vital question. However, looking at the, I was curious to see or notice that advanced practice nurses were not fully mentioned in RNAO's future plans. And when I think of how these nurses have specialized training and knowledge in certain areas, I think it's important that they are utilized in the system and how we advocate for them to be utilized in the system. I worked as an advanced practice nurse at the mental health at CAMH for a period of time, and it was quite interesting how the knowledge that I had and also gained from there, how I was able to use that in my practice. So I think we need to look at all the different knowledge, expertise that is available in nurses with advanced practice, and how we can optimize that to better suit the population that we serve in terms of the healthcare system.
Thank you very much, Carmen. So it's another question around, ONA is also very concerned about RNAO's stand on CCACs. How will you reach out to ONA to get their buy-in? So Carmen, can I ask you to respond first to that? First,
I think I would need to have a conversation with ONA to see what are the major concerns and how do they see the RNAO stand that we take with CCAC. How is that playing out, or how would that affect the population that they care for, or the clients in the community? So this would obviously be necessary for us to have discussion with ONA to see what their concerns are, how we can educate them as to where we stand in dealing with the situation, and how we can get them to understand, and possibly by them understanding will buy into what we are taking a stand in terms of CCAC. I think it's important that we speak with voices that are important for the membership to hear, and for ONA to understand that they have a membership too, a number of people that work with CCAC. So it's important that we are on the same wavelength and they understand where we're coming from and we understand their concerns as well.
Thank you very much, Carmen. Carol, can you respond to this question, please?
Yes, so I am actually aware of ONA's concern with respect to CCACs and how the change is envisioned in the ECHO model and our vision of system transformation. And I think it's critical that as RNAO we actually open up and reach out to ONA and make sure that those lines of communication are open. I think when you step back and look at it, I'm always a believer in going to that kind of common interest base. I think ONA and RNAO have at the very basis of our work what's in the best interest of every individual patient or client in this province. And so I like to come from that common place. And then let's talk about and really understand what the concerns are. And and really work it through. I think with conversation and goodwill, you can accomplish amazing things. But I think it's important to be respectful and acknowledge and value what people are bringing to the table.
Thank you very much, Carol. It has come to light that baccalaureate students are being preceptored by non-nurses in both acute and in the acute care, and in the community. As President-elect, what strategies would you implement to end this practice? So, Carol, I'm going to ask you to be the first to respond to this.
Okay, did you hear me taking my breath? I'm just taking a deep breath to respond. So I'm very concerned about this. This issue certainly came to light at our recent assembly meeting, and quite frankly, I think it's to be blunt, a really unacceptable practice. I think if we're going to ensure that nurses are preceptored and that they're in a learning environment where, you know, nurses can actually model and help them see, learn more about the work that's being done, they need to be preceptored by nurses. So I feel pretty strongly about that. Two things. I think we need to work with our academic partners. I think there's no doubt that there's a real push for lots of students to get into placements. So when I hear where the placements are, it's, you know, there aren't any other nurses in those placements. So I think we have to sit down and really have a serious conversation with our academic partners first and foremost. And I think we need to present the sound business case why nurses need to be preceptored by nurses. So I think this is something, as President-elect, if I were to be elected, I'd tackle really early on.
Thank you very much, Carol. Carmen, could you respond to this, please?
Sure, thank you. I have been aware of this situation for a while I was teaching in the university, and also had clinical, I was a clinical instructor. And I think I understood, because I was concerned and brought it to the attention of the administrators or the directors, and I was told the situation is mainly because there are not enough practice settings for these students to gain any type of experience or any type of knowledge or clinical experience, based on the fact that there were a number of universities tapping into the same ones. This was mostly noticed in the community. Because in terms of trying to find places to put the students, they put them in situations where there were no nurses or registered nurses, and of course, they had never had registered nurses, so most times the students would spend their time explaining to them what nursing was, and they were not gaining much from the experience. I was also told that in any situation, nurses can explain what the role is and find ways to integrate their knowledge and expertise, but it's difficult for students when they're just learning themselves. So as President-elect, this is one situation that I would definitely tackle quite early, because it's important for these students to be mentored and precepted by registered nurses.
Thank you very much, Carmen. Conscious of the time, I will entertain two more questions, one that's on the screen and if there's a subsequent one following, and then we'll bring the webinar to a close after those two questions. To both candidates, what are your strategies to encourage nurses to pursue higher levels of education and training and practice to the full extent of their education and training? So Carmen, could you be the first to respond to this, please?
Sure, I will. I think while we, first of all, I think we need to be listening to our membership. We need to see how they're practicing, what are some of the concerns that they have in terms of their practice. And while I would encourage nurses, which I consistently do in my interactions with them, to pursue higher levels of education and training, and also to be able to practice to their full extent in their education and training, I think it's important for us to understand where some of these nurses are in terms of when they're working, what are some of the issues or what are the challenges for them. So while we're encouraging them to do that, I think we also have to be able to provide opportunities for them to do this, at whether it's financial opportunities, whether it's time, whether it's just making sure that this is what they want to do as well. And I think there's always ongoing education in terms of continuing education and practice, and not necessarily higher education, because sometimes we have to look what that means for the nurses. And it's a vital, it's important that nurses become consistently educated in caring for their clients. So this is, for me, would be very important for me to work with the nurses and the membership, to listen to them and to see what are the concerns for them in doing this.
Thank you very much, Carmen. Carol, would you please respond to this question?
Well, certainly as nurses, I think we are lifelong learners. There's no doubt about that. And I think some may select to advance to graduate level nursing or education and PhD level, and I think that's wonderful. In terms of supporting that, I think, first of all, as RNAO, I think that oftentimes, I think through the Best Practice Spotlight Organization initiative, and what an incentive that has been for nurses in organizations to really look at the role evidence plays in practice, and it has actually been a bit of a catalyst for nurses to want to really continue an area of critical inquiry. And so often that's the springboard for nurses to want to actually pursue higher levels of training. I also think quite candidly that it really makes a difference the organizations they're working in terms of how supportive that environment is. And I think as RNAO, we can really advocate that environments, that healthy work environments are environments that really do support work arrangements that are congruent with advanced knowledge and academic training as well.
Thank you very much, Carol. So I'll entertain one last question. And this is, what does it mean for you to have a membership-driven association? So, Carol, can you respond to this question?
Well, to me, being a membership-driven association is one where we actually truly and authentically engage and take the time and make the opportunity available to engage with members. RNAO is a membership organization. It has to be about you, the members. And I think as a president-elect and as the board, we take our direction from you. You've joined RNAO. It's a meaningful association for you, and we need to hear your voice. We need to represent your interests. We need to understand your concerns. And so for me, it means that as a board and as president-elect, I would need to be pretty in tune with what the members are saying and look at how strategically to best take those issues forward and respond to those issues.
Thank you very much, Carol. Carmen, would you please respond to this question?
Thank you. For me, this is uppermost in my thinking and in whatever I do as a president-elect, is that this is a member-driven organization. I always refer to that, the membership, and that is why my platform talked about mentoring and also membership in particular, how we're going to fully engage the members. Because I think when I think that we have 41,000 members, if they are really engaged and working at to further advance the profession of nurses and also profession of nursing and also the RNAO, I think what an awesome organization or association we would have. And so I think it's important that as a president-elect, I would make sure to be able to go out, visit nurses in their members in their practice environment, listen to their concerns, and see how to address those concerns, and have them be able to set the agenda of the organization, because I think that is important, listening and engaging them so that they set the organization, set the agenda for the organization, because it is their organization or their association. This is a member-driven association.
Thank you very much, Carmen. I want to thank our both candidates for president-elect position, Carmen James Henry and Carol Timmings, for being with us this evening and for not only presenting their visions, but also responding to the many questions that were posed to them by the members. I want to thank you all for joining us for this webinar, reminding you all to remember to vote, and thank you again. Good night, everybody.
Thank you so much, Rhonda.
Good night.
Good night.